With you in a minute if you have any other questions, okay?
Very good. So we're starting here. This one's YouTube, Facebook, and then you're going to get that started up here. So we got the YouTube. Very good. Hello, everyone. Dr. Rich Castellano here, facial plastic surgeon here with Dr. Galen McCullough. Thank you so much for doing our interview today.
Thank you.
And what an honor. What an honor it is to be here. So it's been about 15 years that I came by your amazing office. We interviewed for the fellowship and I ended up doing other things, but wow, what an amazing thing you have done for our academy and for our industry. So thank you. I get to benefit from that in my practice. So really an honor to be here. So we're at the Global Aesthetics Conference and you gave a talk. Tell us about your talk that you gave to our viewers about what it was that you talked about at the meeting.
Well, this morning I talked about blepharoplasty, which is plastic surgery of the upper and lower eyelids. And I took a little bit different approach to it, and it's called a condition-specific blepharoplasty, which means there's no such thing as a one-size-fits-all in plastic surgery. You have to tailor your operation based upon the conditions that you find in every given patient. And so if you're doing the same thing on every patient, it works for some, it does not work for others. So what I tried to do was to encourage our colleagues to pay attention to the problems and then address each one of those problems individually and in an algorithmic type fashion.
Wonderful. I love that. So let me ask you, for all of the things that you've accomplished and achieved, where do you feel your biggest secret is? What was it that helped you most to create the success that you've been able to in your career and for the Academy?
Well, I would say I have a fairly simple approach to everything. Many of our colleagues seem to try to find how difficult they can make things. And I've tried to see how I could simplify every single procedure. Don't do any maneuver that's not absolutely necessary. Don't put a single suture in that you don't need. Don't make a cut somewhere that you don't need a cut. But when you do need it, do what's indicated. And so I think that if there's perhaps something that's worked very well for me and for the 95 fellows now that I'm proud to have had a role in training, is that we try to keep things simple and just don't complicate matters.
I love it. Now, wouldn't it be interesting if when the Academy first started, if they could see a snapshot of today, where things are? I mean, what would they, it's just amazing how far it's come. That's a real before and after picture, where things started and the level to which facial plastic surgeons are performing their procedures, the reputation. I mean, what an amazing spectrum, what an amazing transformation.
We have a lot of new toys. We have a lot of technology, lasers, radio frequency, a lot of things, very expensive toys, as a matter of fact. And then the non-surgical types of treatments with injectable therapies of all kinds, neuromodulators, fillers, and whatnot. But they're all just tools. They're all tools. And when I started, we didn't have all those tools. We used the very simple instruments with surgical blades and scissors and whatnot.
Manual labor.
Yeah, and I still don't know that we're any better off with all of these expensive toys and tools than we were back when I started. And I'm not one to have a closet full of outdated equipment. I've tried to be very selective with equipment that I've bought. If I need it, I will buy it. If I don't need it, I don't buy it. I don't have to try to keep up, or don't even try to keep up with all of the other people that are out there and every piece of new technology that comes along. And if I could give any advice to the young surgeons out there, it would be very selective and don't spend all your money, get too deeply in debt with equipment that you might not need and might be out of date within 3 to 5 years, because there's always something new and better coming along. Stay true to your training, stay true to your profession, be a surgeon first, and then if you want to toy around with some of the other non-surgical things, do that. So I've tried to stay true to that from day one. And I've been at it now 42 years.
There you go.
I've had a great run.
You learn a few things after 42 years. Well, and that's a common issue. I think a lot of the doctors, it's hard to say no to all of the gadgets, and you have to say no. And it's also hard to watch the cash flow, and a lot of doctors get into that problem. So I appreciate you saying that. And so I'm curious, where do you feel your biggest challenge is now? You know, you've made it this far, the successes and achievements that you've made, we've seen the Academy grow. Where do you feel the biggest challenge is now, moving forward?
Well, to answer your question in reverse, the Academy grow. The Academy is having some challenges right now, and there are a lot of meetings, there's a lot of competition, a lot of organizations, And if the Academy doesn't stay true to its focus and the things that made it successful, it may very well continue to see membership drop, and in return, finances drop a little bit. So there, in every organization, you get to a point to where you have to step back and look at where you are, and you may have to reinvent yourself. Sometimes you have to take a giant step back and look at what made you successful in the first place, and then begin to reinstitute some of those things if you're going to take the next step and grow. And so I think that's where the Academy is right now. A little bit of one of those crisis type, not a crisis type situation, but a dilemma, at least to determine what it is we want to be, who we want to represent, who should be our members, and what can we provide for them.
And we're very proud to share that message and move forward, because the dialogue and the discussion is going to help us get that answer. So thank you so much for your time.
Thank you.
This man needs no introduction at all and had a big impact on my career personally, so thank you for all that you've done. And Dr. Galen McCullough here. We'll have more interviews soon. Thank you all for watching. Bye-bye. Okay, so that one's done. And so we keep it that simple. So what I'll do is I'll send you, that was a great interview.